All right. So, welcome to Mental Health Mondays. I am Lucian. I'm a mental health and wellness peer educator. This is my second year with CAPS, I believe. And Courtney, if you want to go ahead and introduce yourself.
Yeah, my name is Courtney. I'm also a mental health and wellness peer educator. This is going to be my first semester being a peer educator, but I'm really excited to be here and get started.
Awesome. So this week we will be looking at some common mental illnesses and how to spot them and also differ them from symptoms that are not associated with mental illness. And that sounds a little vague, but we'll get more into it as time goes on. So some questions you might have, especially like if you're trying to figure yourself out, you're like, is it mental illness or is it just a normal feeling? So some of the common mental health issues that we're looking at today is going to be depression, anxiety, ADHD, eating disorders, OCD, and PTSD. So by no means are we saying that these are the only mental health issues out there, but these are some of the most common ones, and some that we might get confused with our normal healthy emotions. So these are the ones we'll be focusing on. So the first one that we're going to focus on is depression versus sadness. So, and I want to say that for some of these, I did refer to the DSM-5 diagnostic criteria. So this definition of depression might be a little narrow, but I did just want to get kind of a general definition of what we're looking for when we talk about, do I have depression or am I just sad? So to be diagnosed with depression, you must feel at least 5 of the below symptoms for 2 or more weeks in a row in a way that interrupts your normal day-to-day function and in a way that you can't really trace to a specific source of your sadness. So some of these emotions or symptoms, would be like you're depressed every day, you're not interested in things that used to bring you pleasure, you have a loss of energy, you're having significant like appetite loss or appetite gain, so you're gaining or losing weight extremely. It's hard to focus, it's hard to make decisions, or you have that intense suicidal ideation, you're self-harming, or you're making those suicide attempts. So these are kind of the main symptoms of like diagnosable depression. And we have, can I find my little thing? I don't know if you can see my mouse. I wanted to like underline this thing where it's like the 2-week period. So that's kind of the criteria, but normal sadness can include all of these symptoms of depression, but usually they're not as intense and you can usually trace them to a cause. So you might feel all of those things on the previous slide if you've had a loved one die. But in that instance, that those feelings of sadness would be considered normal. It wouldn't be an abnormal sadness because you can trace it to your family member passing away. And other things like disaster, failure, embarrassment. And these feelings of sadness can be acute, but they're usually temporary. So that means they don't last for longer than 2 continuous weeks. It may fade or come back, but usually regular sadness doesn't last for that long of a period without a break. And you can often ease yourself out of being sad using kind of like home methods. Because with depression, people usually need that professional help, like behavioral therapy, psychiatrist, or medication to help themselves out of that. So did you want to say anything? I don't want to like feel like I'm just talking over you. You can chime in whenever you want.
No, you're perfect. Yeah.
Okay. Just checking. So the next one we're going to kind of talk about is diagnosable anxiety versus normal anxiety. Now, for what I've put here, I'm talking about generalized anxiety disorder, again, taken from the DSM-5. There are many types of anxiety. OCD is actually an anxiety disorder, but of course they're very different. But just for the sake of conciseness, we'll talk about GAD. So to get diagnosed with generalized anxiety, you have to feel at least 3 of the following symptoms for more often than not over a continuous 6-month period, and again, in a way that interrupts your day-to-day function. So this could be excessive, uncontrollable worry, you're easily fatigued, you can't focus, you have panic attacks, you have frequent headaches that you can't seem to find a cause for, and you're easily irritated and frustrated. So once again, the big thing is like, it inhibits your day-to-day functioning, and also you can't find a reason for it. So those are the big things you'll find with a lot of the mental illnesses that we talk about, is they bring themselves up in a way you can't define them. So that's a big aspect of being diagnosed with it. But normal anxiety usually lasts for less than 6 months and occurs less than more days, and to an extent can be motivating. So it's like, you have like bad cholesterol and good cholesterol. There's bad anxiety and good anxiety. So like, you can use certain anxiety to motivate you to do better, and often can be traced to a source. So you have an exam, or you have a presentation, or you're taking your driver's test or something like that, and you can learn to cope without professional help, and eventually, hopefully, normal anxiety should fade on its own, and you should come back to like coasting to neutral. Right, it's not clicking. There we go. So the third one we'll talk about is ADHD versus non-ADHD. And so ADHD, or attention deficit hyperactivity disorder, I didn't pull this diagnostic criteria from the DSM-5. I pulled it, I believe, from the Mayo Clinic, but it's still a reliable resource, so we can still go by it. And there's a lot of symptoms here, but to be diagnosed with ADHD as an adult, you have to have 5 or more symptoms of inattention. And on the left, we have symptoms of inattention, or 5 or more symptoms of hyperactivity. And on the right column here, we have symptoms of hyperactivity. You have to have been having these symptoms since before you were 12 years old, and for over 6 months, and in more than one setting, which means you're not just having it at school, you're not just having it at work, you're having it everywhere. So it's a problem everywhere you go, not just a product of the environment that you're in. So I know there's a lot of symptoms up here. You're free to pause and take a look, but there's failing to follow directions, you don't like tasks that require sustained effort, you're easily distracted, you have problems waiting your turn, or you often feel restless. So these are some of the symptoms of like diagnosable ADHD. And when you don't have ADHD, you can still feel restless and fidgety and need to move around, but again, can usually be caused by a traceable source, boredom, sleep deprivation, pressure, something else. And also, we can feel fidgety and restless without a cause, but often enough, it's not in a way that it prevents us from getting the things we need to get done. And that type of restlessness can kind of be managed through conventional means. So I tried to kind of separate, like, the ADHD brain on the left is like everything is everywhere, it's hard to keep track. And then the non-ADHD brain, you kind of have the ability to keep things where they're supposed to be, because of course mental illness is like, or disorders are like, it changes the makeup of your brain. So it's hard. That's why you need professional help to often help those symptoms. So that's kind of like the difference between those 3. And for our next 3, I'm going to shoot it over to Courtney. There we go.
Yes, so next we're going to talk about eating disorders versus just regular dieting. There are several kinds of eating disorders. The main ones that you hear the most about are going to be anorexia and bulimia. And so I'm going to focus more on those 2. I think the important thing to mention about eating disorders as well as dieting is that dieting, while generally a healthy way to lose weight and eat better, whatever your goal is, a lot of the times the goal is to lose weight. And so while it can be healthy, it can also be a really slippery slope to one of these eating disorders if there's no proper awareness or if you're not careful. So first, I want to talk a little bit about anorexia. Anorexia is the restriction of food intake leading to weight loss or a failure to gain weight. In the DSM, it says there's a low body weight involved. I put potentially low body weight just because, you know, like it's not always like that simple. Like you can't tell someone's anorexic just by looking at them. Anorexia involves a fear of gaining weight and also involves having a distorted view of your own body. So your body may look different to you than it does to other people. Bulimia involves recurring episodes of binge eating. Binge eating is eating larger than normal amounts and usually like a 2 to 3 hour window of time. And behaviors to mitigate weight gain from binge eating. So this could be inducing vomiting or using laxative. And it usually occurs once a week for about 3 months. Regular old dieting, any healthy diet is going to include all kind of foods, including junk food. So it's not just going to be like strict health foods, and it's going to include exercise and everything in moderation. So there's not going to be extreme calorie restriction over exercise or purging behaviors. And most importantly, one's self-worth is not dependent on their body image. So I think that's really an important distinction to make too when you're talking about having an eating disorder versus wanting to lose weight. So we can go ahead to the next slide. So now we're gonna go over to OCD. OCD stands for obsessive compulsive disorder. It consists of obsessive unwanted thoughts and sometimes followed by compulsive behaviors to help soothe these thoughts. In order to be diagnosed with OCD, you have to meet a certain criteria, and that is the presence of obsessions and compulsions. The obsessions and compulsions have to be time consuming and create a significant amount of distress in your life. And symptoms have to be unrelated to any substance use. So any drugs or any, even like prescription medications that you could be on that could be causing it. And it has to cause a dysfunction in your everyday life. So over here, I put some of the differences between obsessions and compulsions. So obsessions, they involve recurring, intrusive, unwanted thoughts that cause a significant amount of emotional distress. And I think sometimes people use intrusive thoughts and obsessions kind of interchangeably. And I think there's a really big distinction between intrusive thoughts, or I should say unwanted thoughts, and intrusive thoughts. Intrusive thoughts are typically disturbing. They're unwanted, obviously, and they're really hard to get rid of. So they keep coming back to you. So an example of this would be recurring thoughts about contracting an illness that causes a great amount of fear and anxiety. And granted, I know we're in a pandemic, so that's basically a lot of people right now, but the difference is that it cannot be soothed by mindfulness or rationalization. So that fear is just going to keep coming back. Compulsions are repetitive behaviors like physical or mental behaviors. So this could be like tapping doorknobs or counting or praying that one engages in to reduce the anxiety of the thought, or even thinking it could prevent it from happening. So for another example, if you have recurring thoughts about contracting an illness, you might be overwashing your hands repeatedly when it's not necessary. And we can go to the next slide. Great. So OCD is a misunderstood mental illness because it's kind of become an adjective a lot of the time, because like sometimes you'll hear people say like, oh, I'm so OCD. And like what they're really referring to is like, they probably like prefer order and they prefer uniformity, and maybe they value cleanliness. Some non-OCD thoughts and behavior is valuing that cleanliness, preferring patterns. Any unwanted thoughts can be rationalized, like I said before, and fears and anxiety can be soothed through mindfulness or another distraction. As opposed to OCD, any cleanliness or hygiene issues is going to be fear-based. And so it's doing it to prevent something and not necessarily because you prefer it that way. You would have anxiety over things that are not uniform. Any unwanted thoughts or intrusive thoughts can't be rationalized. And fears and anxiety are soothed through rituals. And interruption of these rituals can cause a lot of distress and frustration and anger in people. All right, so PTSD. PTSD stands for post-traumatic stress disorder. It typically occurs after a dangerous or disturbing experience that somebody has. And it was first attributed to veterans after returning from war, but can be associated with all kinds of different traumatic events, from car accidents to domestic violence. So some symptoms of PTSD are obviously exposure to, witnessing, or having some sort of association with a traumatic event, recurrent intrusive memories, recurrent dreams involving the event, memory loss, internal or external triggers. So this could be something that you hear or even just think that can maybe set off a panic attack or anything else of the sort. Flashbacks, depressed, irritable, or anxious mood, and also dissociation, which is different, can be experienced differently for a lot of people, but in a general sense, it's kind of an emotional and physical detachment from your body. So you don't really feel all there. Kind of like you're like looking in through a window of your own life. We can go on to the next slide. So there's not a super comparable behavior for anything that's not diagnosable PTSD. However, it can be mistaken with other disorders, especially anxiety disorders. So generalized anxiety disorder, any phobias or depression. But it's important that if you do have any symptoms of it, that you reach out to a professional so you can get an accurate diagnosis for whatever's going on. And speaking of professionals, if you do notice these symptoms in yourself or others, it is important to start a conversation with your family, friends, peers. Just check in with yourself and with your friends, and just see what's up and how you're doing and how you're feeling, and just evaluate that. If you do notice these symptoms, there is CAPS, the Counseling and Psychological Services for all of UMM Dearborn students. It is located on the second floor of the Student Union. So if you just go up the elevator or the stairs, it's going to be right there.
Otherwise known as the UC.
Oh, yeah. Oh, I call it the Student Union. I think that's what I called it at my previous school.
I think in Ann Arbor it is called the Student Union, but at Dearborn it's called the UC. Don't know why.
The UC. Yeah, that's what I meant. The CAPS has qualified counselors, so you can go there. It's not student counseling or anything. They have professionals. And most importantly, it is completely free to all students and confidential. So definitely utilize that if you feel you need to.
Yeah, and that's about all we have. I know no one hopped in today, but for those who are watching, we will be here next week. We have all the flyers of the specific Mental Health Mondays occurring every Monday on CAPS's Victor's link, I believe. So you can check that out because it's a different topic and time every Monday. They're all very interesting. And if you have questions or you want to make an appointment or you want to know about more CAPS programming, I do have CAPS's email down here at the bottom. And you can email that and someone will get back to you. And just like Courtney said, if you do want to make an appointment, they are all professionals. They're licensed. They have doctorates. They have masters. So it's not... you're not sitting in front of like people like us trying to give you therapy. Exactly. Like you actually have like qualified professionals who are there to help you. So that's about all we have. These things rarely go for an hour, usually about 20 minutes. So I think with that, I will stop the recording. Thank you guys for watching.